Hey everyone, this is Mike, and welcome to another term of Healthcare Update. This is an overview of the healthcare scene for April 4th. And I thought it would be useful to start with a kind of a high-level overview of where we are. We've had a lot of wild debate in the past couple of months since the Trump election. A lot of efforts to change the healthcare system, and nothing is panning out, but let's just take a minute to see where we are. And the first thing I wanted to do was just, because we access these discussions through a political discussions, I thought it would be useful to kind of lay out where we are. And again, I've mentioned this before, but the political lens for looking at health policy doesn't make sense in a lot of ways. And I've talked about that before. But let's say on the far left, we have single-payer healthcare. And during the 2008 to 2010 political debates about health policy, the single-payer system, although strongly favored by a core group of constituents, there's not a widespread acceptance of that system. And in single-payer system, the federal government would pay and decide who gets what. Healthcare is a scarce resource, and we have to decide how to allocate this scarce resource. There's always going to be winners and losers. We just can't give everybody all the health care that we want. We have to develop some kind of rationing mechanism. And what we're trying to do is to come up with an approach that is fair and science-based. That's the debate. That's the high-level debate. On the political right, and say the Wall Street Journal is a good representative argument for this. If somebody wants health services, they should just buy it. That's their individual right and freedom. They should just go out on the market and get it. And it is the individual's responsibility to provide these resources. And then in the middle, or towards the middle, we have like the Affordable Care Act. Now, I've talked about this before, and I don't see the Affordable Care Act in the middle. I think before the ACA, we had a healthcare system that was pretty much dead center in the middle. And I think the ACA knocked it to the right because it created these marketplace exchanges and codified the existence of insurance companies and established their role forever. And that would be one of the characteristics of single payer, is we wouldn't need health insurance companies. So anyhow, and there's the patients choose. It's a very much a free market system. So I always envision that the ACA pushed our healthcare system to the right, into a market-based system. Now we have the American Health Care Act being promoted by congressional Republicans. Now that kind of moves it to the right, but not to a pure market system. Now notice that we are having all of this debate and discussion between the ACA, pure market, AHCA, on the right. Our great debate, healthcare debate today, is happening on the right. Now, back in the 1970s when Kennedy was debating Nixon, it was way over on the left. And they were debating gradations between single payer and should you allow the existence of any health insurance company. In other words, would you allow secondary supplemental insurances? That's where the debate was on the far left. Now we're on the far right. Single payer is Medicare for all, okay? So just like Medicare is much beloved by our senior citizens, but although it does not pay everything, it pays 80% after an initial, I think it's up to about $200, $250 that patients have to pay in January. And a variation of this could be Medicare for many. Rather than beginning at 65, eligibility beginning at 65, and for those who are disabled, move it down to 50. One of the proposals I've heard recently is what makes Medicaid expensive. The vast majority of the expense for Medicaid comes from the elderly who require institutional care and intensive services. Move all that over to Medicare. You would not have employer-based insurance, so those of us who are employed would have to, 50% of the population would have to give up their insurance to go Would they allow copays? Would have to see. Would there be any kind of skin in the game, or would patients just be free to advocate for as many services as they wanted? And there would be panels of experts who would decide who gets what. There would be, for pharmaceutical industry, there'd be a single formulary. If you could get on the federal formulary, you would be golden. If you could not, you'd have to go overseas. Would you allow supplemental insurance? For pharmaceutical prices, would they negotiate, or would the price be set? For example, in the European Union, some countries will take the average. If you're trying to bring a drug on the market, they will look at the other EU companies and take the average of the top 3 or the bottom 3 companies. So you get a big gray market in the European Union with drugs going across the border in people's trunks. So that would be single payer. The ACA, it's a mixed market-based system, and a lot of the debate, a lot of the hardship, comes in this group of about 10% of individuals who are 10% of the population who's on the individual market. And the basic rationale of the ACA is get everybody into the healthcare system. Then once we get our arms around it, then we can start to manage cost and quality once everybody is in. And the argument is that the healthcare system doesn't function as long as some part of the population is left out. So, it aligns with this notion of healthcare as a right. Give subsidies in the poor and the working class to make sure that they can get into the market. Remember, the ACA gives subsidies of households of 4 up into the $95,000. Everybody still has this. It's a market-based system, so people have skin in the game. They have to make economically rational decision makers. Patients have to pay some. CMS has a very strong influence. CMS is although we have many, many insurance companies, CMS is the strong influencer of what happens. So there's still this strong federal influence. And public health has a strong role. And the pharmaceutical prices are set by the market. The feds cannot negotiate what Medicare will pay for their drugs, and that's getting to be an expensive thing. The AHCA, and of course we have no idea what they're going to do, but they basically keep the basic ACA system and they change some of the names. There's a strong preference to state choices. Let's move this out to the states. So it increases the complexity of our healthcare system. We have each state has a basic healthcare system for employers. Then you add in a separate Medicaid system for each state. Then you add in all the differences. Many of the states have differences. There's about 27 variations of the health insurance exchanges under the ACA. Plus there's the VA. Plus there's TRICARE for active military. And it's very, very complex. And this will enhance the complexities. Patients will make all payments. Everything will go through patients having to bear the full brunt of the patients will have to pay the list price to get insurance. Now they'll get primed with tax credits for those who need it. We don't know what the structure of that will be, but they'll take away the requirements for insurance, but there'll be strong incentives and under some proposals, automatic enrollment with the ability to disenroll. Pharmaceutical companies will have an easier time of getting their products through the FDA, but there'll be expedited review, but will there be increased monitoring once it's out to see if there's any problems? Insurers will regain some of that freedom to vary the price they charge their customers for health insurance. Will we go back to medical underwriting? We don't know. Pure market, full medical underwriting. Insurers can charge whatever they want. Pharmaceutical companies can put whatever they want on the system. Perhaps the FDA would check it to see if it's safe. But if a customer wants patient wants a new cancer drug, fine. Don't let the FDA will not create any barriers. Patients will decide if they want health insurance. If that's right for their family, then they can go out and buy health insurance. There would be total skin in the game. Patients do what's right for them. Tort reform. So it's a buyer beware, a full free market system. So that's where we are. We're debating this on the right, and really we're talking about gradations between the ACA and the AHCA. So pharmaceutical life sciences. There's a lot of focus on what Trump is going to do. Forget what Trump is going to do. Your main problem is the declining ROI on R&D. How does pharmaceutical companies create value? Your ROI on R&D has gone from 15% 10 years ago to 3%. And there's a Deloitte UK report out on that for more details. Are you going to lose customers? If they go to a full free market system, you're going to lose. You made the grand bargain with Obama, the pharmaceutical industry, and in exchange you got tens of millions of new customers. Now, are you going to lose those customers, in these future changes to the healthcare system? Will you get this expedited drug approval? That sounds great, but remember, President Trump froze federal hiring, and he put the brakes on federal regulations. Well, the CDER, the unit within the FDA that approves drugs, has tremendous turnover. Pharmaceutical companies want to hire these people once they get any experience under their belt, and now there's a hiring freeze. There's a strong movement for the feds, CMS, to negotiate. They have a lot of power. Will the pharmaceutical industry have to negotiate? Will we move to value? The new administration is not talking about value-based care at all. So is this a simple delay shift to value? A lot of insurers are going ahead and creating these value-based contracts. So we'll see what happens with that. We have this bill which is designed to advance the pharmaceutical industry, but now there's this regulatory freeze. So we don't know how the 21st Century Cures Act will be implemented. There's a lot of tax and trade issues. Mr. Trump wants to pull back from all of our trade agreements. Well, if you lose the TPP, which probably is going to happen, you lose biosimilar and IP protection overseas, which is huge if you're trying to get into India or China. They're talking about this border adjustment tax, which the pharmaceutical industry, a lot of their supply chain, a lot of their ingredients for these compounds and processes come from overseas. The border adjustment tax may block that supply chain. These corporate tax reform has the ability to address some of the inversions that took place over the past 5 or 10 years, and will they make that retroactive? Anyhow, these are some of the issues that's facing the pharma and life insurance. Of course, Brexit, pharma is international. We tend to think of pharma as being a US kind of industry. It's very, very international. What's Brexit going to do to the pharmaceutical industry? And then you have to think about what's happening in emerging markets. Okay, so that's a quick, although extended, update for what's going on in the week of April 4th. I'll see you later. Give me a call if you have any questions.